COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Every country must be ready for its first case, its first cluster, the first evidence of community transmission, and for dealing with sustained community transmission. These are 4 scenarios. And it must be preparing for all of those scenarios at the same time. No country should assume it won't get cases. That could be a fatal mistake. And quite literally, this virus does not respect borders. It does not distinguish between races or ethnicities. It has no regard for a country's GDP or level of development. The point is not only to prevent cases arriving on your shores. The point is what you do when you have cases. But we're not hopeless. We're not defenseless. There are things every country and every person can do.
As the World Health Organization raises the global risk assessment to its highest level, at least 54 countries now reporting infections, more and more countries now taking steps to stop the spread. In fact, schools in Japan, Hong Kong, and several other countries are now shut down. In fact, today was the last day for Japanese students for at least a month. And in Italy, look at this image tonight. Soccer games are being played in completely empty stadiums. And tonight, Pope Francis, who was out in public on Ash Wednesday, sending a message on coronavirus, now canceling some events, raising some alarm amid reports he now has a cold. ABC's James Longman tonight.
Tonight, precautions becoming more radical around the world. In Lebanon, students sprayed with disinfectant, testing for fever on the spot. The WHO raising the global risk assessment to its highest level and a blunt warning.
It's really not much of an excuse at this point to get caught unawares. This is a reality check for every government on the planet. Wake up, get ready.
Switzerland taking drastic action, becoming the first country to outlaw any gatherings of over 1,000 people. In Japan, a nationwide school shutdown. 12 million students ordered to stay home by the Prime Minister. But he's insisting the upcoming 2020 Tokyo Olympics are not in danger, although some fear they could be cancelled. In Italy, an eerily quiet soccer game in an empty Milan stadium. Italy is spooked. It has more than 600 patients hit with the virus. Pope Francis, whose Ash Wednesday Mass expressed solidarity with those infected, now has an apparent cold. There's no indication it's linked to coronavirus, but he has cancelled all his audiences. In Iran, another viral epicenter, the most senior female official is infected. She was at a cabinet meeting with President Rouhani just days ago. This coming on the heels of the country's infected health minister sweating and coughing while urging calm, which sparked fear that Iran was underreporting the gravity of its outbreak.
If you decide to wear a medical mask which is pleated and flat like this one, it is important to wear and discard it correctly. Otherwise, instead of protecting you, the mask becomes a source of infection because of the germs that may stay on it. To wear it correctly, you should locate the metal strip at the top of the mask, place over your nose bridge, secure the elastics around your ears or tie the strings behind your head. Make sure it covers your nose, mouth, and chin. While in use, do not touch the front of your mask. To remove the mask, take the elastics from around your ears or untie the strings behind your head. Do not touch the front of the mask as it may be contaminated. Remove the mask and discard in a closed bin. Cleanse your hands with alcohol hand rub or soap and water. Hand hygiene should be done if you accidentally touch the front of your mask while wearing it. If your mask becomes damp or humid, replace it with a new dry mask. Never reuse single-use masks and discard them immediately into closed bins after each use.